Yes, they had to go back. Yes.
Sorry about that.
It's okay. That's all right.
He asked me that.
Yes, but I asked and I went back and I looked at Dr. Deitch's information. No, no, no. You have nothing to apologize. I'm just explaining to you that, yes, there were two separate operations. I don't know where it's leaking from. You don't see a leak. I looked back at Dr. Deitch's pictures at the end of the case last time. I didn't see a leak there either, okay? We don't see the leak here, but there's something that's leaking. Whether it's coming from behind the aneurysm, whether it's coming from the graft material itself, I don't know, and this is acutely getting larger and causing pain. The only way to fix this is to try twice to go in with trying to put grafts in, and it's not going to work. Wherever the problem is, it's sort of going to require an open operation to fix it. Okay, so what I'm going to plan on doing is to try and go in there and remove the old graft and put in and remove that portion of the aorta and replace it with a piece of fabric. Okay, that operation requires clamping the main blood vessel, the aorta. There's a risk when you do that. There's always risks to the heart and lung. There's always a risk during this of significant bleeding, which is probably why the thought was to try and repair this minimally invasively in the past, but that has now failed. I would hope to do that minimally invasive if I could, but I don't see any other way of doing that. Okay, there's a chance afterwards he will likely to remain with a breathing tube in his mouth. He'll be there for a few days at least. He's going to be in the intensive care unit. If everything goes smoothly, hopefully in a couple of days we'll take the breathing tube out. But you may get sicker before you get better. Okay, there's a risk to your life. This is a life-threatening situation, or I wouldn't be doing this on Saturday afternoon. Okay, if I didn't think that this was a life-threatening, and even the operation itself is very dangerous, and I wouldn't tell you otherwise. Okay, I'm hoping that this will go very smoothly. Sometimes you open it and you can actually see the source of bleeding, and maybe I don't have to take the whole graft out. I don't know that. A little bit is, I'm not sure what I'm going to find when I get in there. My intention is to take the whole thing out and to start again from the beginning with a open repair. We've had to do this before with certain patients, and even patients have ruptured from a leak like this, which you don't see, and then they rupture, and that's a life-threatening situation. If I didn't think that it was getting worse acutely.
You think you could, I mean, once you go in?
I think I can fix it, of course. I think I can do that. I've done it before, but again, you're dealing with a place where you've been through an operation before, and the tissues are what they are, and the only problem is you can't leave him this way. If you leave it, it'll rupture and you could pass, which I don't, if I have a chance to do something, I would do it, and that's where we are. Yes, we've been successful. The best way to do these kind of operations is on a more elective basis, but he has the other issue of having the blood culture issue, and so he has some reason that he was in the hospital already, which is going to make it more difficult. But we've had success with repairing the aneurysms before this way. And having to take out the mesh before and take out the grafts and have to replace them.
Were you able to confer with Dr. Deutsch at all?
He's on a plane. I know he's on his way out to California. But I saw his notes. I saw his pictures.
I'm not questioning you.
I wasn't. No, I wasn't there. But again, as I saw all the pictures and read all his notes. I'll tell him as soon as he lands. We did send him a message so that as soon as he lands, I'm sure he'll check in. But I know he was on the plane out to California.
And Dr. Hogan said it could be 6-8 hours.
Yeah, it could be a while. It'll be at least 6 hours.
Can you update us?
I'll do my best to send someone out at around 6 hours to let you know how things go.
She told us already that the man Saturday.
Right, so I will do my best to have someone come out and let you know what's going on. I'll do my best, okay?
It'll be good.
Okay, I will.
The pain is bad.
I know. And there's nothing else.
So waiting, the longer you wait, it's not good.
He's not getting any better, and this has been going on since yesterday.
I'm gonna have you sign.
And when I saw you in the morning, you were worried, and this was something that was new from yesterday. which means that whatever it is weakening the wall, and
This does not
there's
include the
even
red
some
Corvette.
inflammation around the
That comes
aneurysm,
separate.
which wasn't there 10 days ago.
That's why I called Dr. Well, I didn't know Dr. Orton was gonna pick up, but that's why I called because I
You
knew-
did the right thing, and you absolutely did the right thing, because
Wow.
and I was
waited a
concerned
couple
this
days,
morning.
And I said, and I told her, it doesn't sound right.
No, this is not right. It shouldn't be like this. Usually, even if you have a slow leak, that slow leak usually, patients that when it grows slowly don't usually complain acutely of pain, which is, this pain started yesterday, Mr. Kosher? Yeah.
No, he had it
No,
for
it was-
3 days. I was rubbing
3 or
his,
4 days.
But it wasn't as severe, it just kept getting a little bit.
Right, a little worse, a little worse. But I
kept-
think what was happening, whatever it is slowly pushing out at the aneurysm. As the blood vessel
See, that's
distends,
what you were
it's
feeling.
becoming more and more weak. And there's
he
more
kept
of a-
saying he had pain. I said, well, how could you have pain? Everything was good. Your vitals, your thing.
And his vitals are fine, which is good. It's
Yeah.
better that you're going in. Your blood
Right.
pressure's not low, so we're okay. So we can do this on a kind of urgent, but not. I'm not rushing you in.
It's not-
You're not starting out
like the first
behind,
time.
which is important. Yes, it's better you're not starting out behind. Okay, but it's going to take a while. I'll try and send someone out to at least give you some kind of a message.
Do what you have to do.
I know, but I understand.
We're praying for
But
you,
expect it'll be about 6 or 8 hours. Okay.
But it could be that you go and see it's not as bad as it is too.
It's still gonna take
So
that long.
it's going to take that long.
Yeah, you still have
There
to-
are some times when you go in there and you see the leak, and you could if I can open it and I see that where the leak is, and I can just put some stitches in whatever the leak is. There's a possibility of leaving the whole thing behind, because the less I do the less I have to do, the better off you are. But I am going with the intention that most likely I have to take the whole thing out, because unless something
work
is
backwards.
absolutely, I see a big hole in the fabric that I can close, then obviously I'll do that. But if anything else, I'm going to be forced to take the whole thing out, because there's a lot of material in
It's
there,
gonna die.
and I have to be sure that where it's coming from.
Could you, yeah.
Yeah, we're gonna get him in the OR. Then they'll give him
Thank you,
something in
Doc.
the OR would be the best thing
Thank
to do.
You
Okay?
signed